Welcome back to Ma'am Fredz's virtual classroom. Today's topic is all about inferring how one's lifestyle affects the functioning of the respiratory and circulatory systems. As we go deeper into this lesson, we will be discussing the different diseases of the respiratory and the circulatory system, as well as how our lifestyle affects the proper functioning of these systems. First, we will talk about the diseases of the respiratory system, as our lifestyle and our exposure to viruses and bacteria and other environmental pollutants may increase our susceptibility to respiratory diseases. These diseases may prevent the respiratory system from functioning well. First is the common cold. Common cold is characterized by sneezing, runny nose due to nasal congestion, and a mild fever. It is caused by viruses infecting the upper respiratory tract. It usually lasts for about a week and can be relieved by taking enough rest and drinking a lot of fluids. However, if symptoms last for more than a week, it is advisable to seek proper medical treatment and cover the mouth when coughing or sneezing to prevent the virus from spreading. Next is influenza or flu. It is characterized by chills, fever, severe headache, muscular pains, runny nose, and fatigue. It is caused by influenza virus, which may come from birds or swine, which can be transferred from person to person through sneezing, coughing, or touching surfaces. Flu may last for 2 to 5 days, but in severe cases, it can last for more than a week and can lead to pneumonia. Flu can be treated with enough rest, drinking a lot of fluids, taking antiviral medicines, and vaccines. Now, let us discuss pneumonia. Pneumonia is an infection of the lungs. It happens when the alveoli become inflamed and filled with fluid, which is caused by bacteria, virus, fungi, or protozoa. Pneumonia is characterized by cough, chest pain, fever, and difficulty of breathing. Pneumonia can be treated by taking all prescribed medications. In case of doubt, pneumonia can be confirmed via chest X-ray accompanied by a blood test. Now let's talk about tuberculosis. Tuberculosis is a chronic disease caused by a mycobacterium tuberculosis, which can be transferred from one person to another through coughing, sneezing, or spitting. People with TB may experience the following signs and symptoms: severe coughing with blood, weight loss, fatigue, fever in the afternoon, loss of appetite, pain when breathing or coughing. To prevent the transfer, people with TB should use his own eating utensils. TB can be cured with proper medication for at least 6 months. Next, we have asthma. Asthma is a chronic and allergic condition. People suffering to asthma experiences the following signs and symptoms due to the production of mucus when breathing airways swell and become narrow. The exact cause of asthma is unknown, but it can be triggered by the inhalation of dust, pollen, or fur. Asthma can be relieved by eliminating the triggering agent or by using bronchodilator. Another disease of the respiratory system is the bronchitis. Bronchitis is the inflammation of the bronchi. It is usually caused by virus and bacteria, but can also be triggered by industrial pollutants and tobacco smoke. Bronchitis is characterized by a cough with phlegm and difficulty in breathing. Bronchitis can either be acute or chronic, and these are their characteristics. Acute bronchitis lasts for 1 to 3 weeks. It can be treated with enough rest and drinking a lot of fluids. On the other hand, a chronic bronchitis lasts for 3 months or more. It can lead to the production of excessive mucus and infection from microorganisms. The treatment can be used are antibiotics and proper medical attention. Emphysema, on the other hand, is a chronic disease where the alveoli as well as the breathing passages are damaged due to prolonged exposure to tobacco chemicals and air pollutants such as fumes and coal. People with emphysema suffers from difficulty and pain in breathing since some parts of their lungs are damaged. These damages cause difficulty of getting enough oxygen as well as of eliminating the carbon dioxide. Emphysema has no treatment, but its progression can be slowed down when the patient stops smoking. Using bronchodilators, antibiotics, oxygen supply, and surgery to remove the damaged tissue might also help. COPD, or the chronic obstructive pulmonary disease, is the term used for people suffering to any combination of the following lung diseases: emphysema, asthma, and chronic bronchitis. So the patient that acquires emphysema has no treatment. People with COPD may experience difficulty in breathing due to long-term obstruction of airflow. The possibility of pulmonary infection may be slowed down using antibiotics. COPD is caused by tobacco, including the second-hand smoke. Thus, smoking should be stopped. Lastly, we have lung cancer. Lung cancer can be acquired from a long-term exposure to tobacco smoke. Tobacco contains carcinogenic chemicals which can cause uncontrolled growth of tumors. These tumors may occupy the space in the lungs which is supposedly used for gas exchange. The symptoms of the lung cancer are coughing with blood, mucus production, weight loss, shortness of breath, and blockage of airways. There are some ways to treat cancer, such as chemotherapy, radiation, or removal of the damaged part. Now let's talk about circulatory diseases, or the diseases of the circulatory system. Eating high-fat and high-cholesterol foods, nutrients deficiency, smoking, and sedentary lifestyle, especially if you're not exercising enough, can result to various circulatory diseases. These circulatory diseases are classified into 3: disorders of the blood vessel, disorders of the heart, and disorders of the blood. Let us first discuss the disorders of the blood vessels. First is the atherosclerosis. Atherosclerosis is a disease where plaque consisting of cholesterol and other substances are built up in the arteries. Smoking and high-fat diet contribute to plaque buildup in the arteries. These plaques in the arteries narrow the diameter of the arteries, which impedes the blood flow. Next is the stroke. Stroke is the sudden loss of the brain function when the blood supply to the brain is cut off. Blood supply is cut off due to the blockage of the arteries in the brain or in the neck vessels. Due to this, the brain gets deprived of oxygen causing the brain cells to die. There could also be a blood clot within the blood vessels that can block the blood flow. Next is hypertensive heart disease. Hypertensive heart disease is characterized by chest pain, a pressure in the chest, shortness of breath, fatigue, and pain in the neck due to the thickening and enlargement of heart to force the blood flow through the tightened arterioles. When this happens, the heart may be unable to pump enough blood. It may beat abnormally or doesn't get enough oxygen. Now let us discuss the disorders of the heart. Coronary heart diseases is characterized by the inability of the blood to reach to the coronary arteries of the heart. Atherosclerosis or aging may cause the thickening of the arteries, resulting in a low volume of blood flow. The reduced blood flow may cause pain in the chest, left arm, and damage cardiac tissue. Coronary heart disease may also cause heart attacks when cardiac muscle dies. Another disorder of the heart is the rheumatic disease. Rheumatic heart disease is a condition in which the heart, specifically the valves, are damaged by rheumatic fever caused by Streptococcus pyogenes. Rheumatic heart disease is common to children. Some symptoms of the rheumatic fever are fever, joint swelling, stomach pain, and some rashes. Rheumatic heart disease can be treated through the use of antibiotics to prevent the rheumatic fever or surgery to repair or replace the damaged valves. Now let us discuss about the disorders of the blood. First is hemophilia. Hemophilia is an inherited disease characterized by a continuous bleeding and difficulty in clotting. It is caused by the affected mother to her male child. Hemophilia is caused by the lack of one plasma protein needed for clotting. To speed up the clotting sequence, anti-hemophilic factor or AFH is used. Worst cases of hemophilia will lead to anemia due to continuous and excessive bleeding. Thus, transfusion may be needed for too much blood loss. Another disorder of the blood is anemia. Anemia is a condition where the red blood cells in our blood decrease in count. This results to decrease of oxygen in the body tissues. Anemia can either be inherited, caused by nutrients deficiency, excessive loss of blood, red blood cell destruction, or bone marrow problems. Eating iron, vitamin B12, and folate-rich foods, taking supplements, and sleeping for 8 to 10 hours can help prevent anemia. Other medications include radiation therapy and chemotherapy. Last is leukemia. Leukemia is a cancer of blood cells such that there is an abnormal increase of white blood cells or leukocytes. Huge or numerous white blood cells are produced, taking the entire space while giving only a little space for red blood cells and the blood platelets to grow. Common symptoms of leukemia are pains in the bones or joints, fever, loss of appetite, discomfort in the abdomen, and bruising easily. Leukemia is usually treated either with chemotherapy, radiation therapy, and bone marrow transplantation. Summing up our today's topic, these are the diseases of the circulatory system: common colds, bronchitis, influenza, emphysema, pneumonia, COPD, tuberculosis, lung cancer, and asthma. The disorders of the circulatory system are classified into three. You have the disorder of the blood vessel, disorder of the heart, and disorder of the blood. The disorder of the blood includes hemophilia, anemia, and leukemia. The disorder of the blood vessels includes atherosclerosis and stroke. Disorder of the heart includes coronary heart disease, hypertensive heart disease, and rheumatic heart disease. In summary, we have learned that the functioning of our circulatory system is affected by our lifestyle. Most circulatory system diseases are caused by high-fat, high cholesterol diet, nutrient deficiency, sedentary lifestyle, and smoking. And that respiratory diseases are usually caused by exposure to bacteria, viruses, and environmental pollutants such as tobacco smoke, coals, and fumes. Some respiratory diseases could be relieved by just enough rest and drinking a lot of fluids. We also learned that some require serious medical attention. We can also improve our lifestyle to spare ourselves from the respiratory diseases. We can also spare ourselves from these diseases by avoiding smoking, washing our hands often, restricting from going to places where we can be exposed for too much pollutants, and taking enough rest. And that sums up our lesson for today. Always remember to take good care of your body. Our lifestyle affects our well-being. So listen up, have a healthy diet, and avoid vices. See you in our next class.